All right, when we're talking about hip dominant patterns, it simply means the hip is going to go through a bigger change in angle versus, say, a joint like the knee. So we want to make sure that we are using the hip joints to produce that movement, and a stick or a dowel PVC pipe is a great way to work on that as far as a training tool. So let's cover a couple things first. I always think about that distance between the ribs and hips. So if you go thumb, the bottom rib, and then little finger on the ASIS, we want that position to stay the same all the way through our exercises. So if that distance gets closer together, I'm going through lumbar flexion. If that distance gets further apart, I'm going into lumbar extension. And what we want to do is work on being stable through the midsection and driving this movement through the hips. So with the hip hinge, very simple way to think about it. Starting out, your hip is aligned over your ankle, and all you're going to do is drive your hips back behind your ankle as far as you can, and then come right back up. Now, if your hips go back, your shoulders have to go forward. So because we have the ability to move our spines, we can go hips back without the shoulders going forward, and it drives people into too much extension. So if I push my elbow back, my fist has to go forward. That's how I want you to think about this. Your hips are going to represent the elbow, and then shoulders would be the fist. So make sure if one part's going back, the other end of that needs to go forward. So one way to help gauge that is using stick dowel PVC pipe. And all we're going to do is run it down the back so that you have 3 points of contact. Your tailbone's in contact between your shoulder blades and your head. So once we have these 3 points of contact, I want to execute a hip hinge without losing any of the 3 points. So what often happens is people come down and they're going to lose that tailbone position first. So make sure you feel that contact. If this is as far as you go before you begin to go into flexion, then that's your range for now. And what we need to do is just build on that versus worrying about trying to get down all the way every time. So in a perfect world over time, we're going to be able to hinge all the way over and maintain our 3 points of contact. So now that we've got the hip hinge component in there and we've got the ability to maintain proper position through the lumbopelvic area, let's make sure we're really getting those glutes on, because that should be your primary driver. So from a front view, we're going to take hip width maybe a little bit wider with your stance. We would rather be a little bit more square with the feet versus toed out. First thing you're going to do is simply try to stretch the carpet, turf, whatever you're standing on, apart, but your feet aren't going to actually move. So we're creating an isometric contraction or activation of your glutes. Now we're going to go through some external rotation. So you're taking your feet and you're trying to screw them into the floor. So the movement is pressure with the heel in and the forefoot out. But again, you're not trying to move the foot. We're simply engaging that so that we can get the glutes on a little bit better. So I have outward pressure and then I have a little rotation. Now I really feel those glutes on, and then I'll go through my hip hinge, and every time I come up, make sure I squeeze the glutes and then right back down. Now when we think about your feet, so we're always going to go tripod weight distribution, meaning your big toe mound has contact, your little toe mound has contact, and your heel. We don't want to lose any of those points, but you are going to shift more weight into the heel point. So right now I'm pretty even across my 3 points on the tripod. As I hinge, I'm going to put more weight into the heel, but I'm not going to lose my big toe position or the big toe mound. So drive the hips back, weight on the heels. That's how you're going to really load into the glutes, and then come back up instead of getting the weight on the forefoot and trying to hinge. And you'll know because you're going to feel your calves turn on. So that's a pretty good signal that you've got not enough hip hinge or you're moving forward too much. If you go through the movement and your calf is just on fire, then you need to work on getting back here a little bit more, take pressure off of the forefoot, just don't lose contact points, and then come back up. All right, so we've got our position, we've got our movement, and we've got our activation. So one of the things you can throw in to make it a little more effective from the bottom coming up is engage in the pelvic floor or a Kegel exercise. So once I've gone through separating the floor, screwing my foot into the floor, driving the hips back, pelvic floor engagement. So Kegel exercise, then come up, and then squeeze the glutes. So I don't do this every rep of every exercise I do, but I do typically throw it in either once in a while as a set of 10 to make sure everything's firing properly, or I may prime the system and do about 2 to 3 reps like that, and then immediately go to my loaded position so that I can reinforce that. So that's covering bilateral. We obviously have unilateral, and for the most part, the movement is exactly the same. There are just a couple of other things that you're going to need to think about. That weight distribution concept, it's going to be more important here because there's a huge tendency to go into the ball of the foot, and right now my calf is on, but there is not a whole lot going on the back side. So what I want to do is make sure that I'm sitting back into my heel without losing the big toe mound, and then bringing myself back up. Now I've put the glute in a better position. I'm going to use a lot more of it as I come up. So the hip hinge is the same, the position here is the same. You're not going to have that ability to separate the floor or rotate, but ideally you've gone through bilateral first and this stuff's already happening naturally. So the biggest thing in single leg that you need to keep an eye on is not what I call spinning out. So belly button should be straight ahead starting, and as you hinge, I tend to think belly button pointing towards the center of my foot, or you could even try pointing it towards your little toe. What that's going to do is help you keep your pelvis level. A very common error is people come in and then they rotate. And it's either one of two things. They have some tightness, lateral aspect of the leg, so they're having to give to that, or they just simply don't have as much stability, so that as they move, they have to shift their center of gravity over their foot because their hip isn't kicking in to hold them in position. So with single leg, we're going to make sure that we keep all those connections, but we're nice and level and we're not spinning out. And then right back up. So whether it's bilateral or unilateral, same concept. We want to make sure we're rooted properly. We want to make sure we're moving through the hip joint and that we're not moving in this area between the ribs and hips. Make sure you turn your glutes on. Good squeeze at the top every time. You'll get a lot more out of your exercises.